Hello and welcome. Good morning. My name is Amanda Milstein. I'm a primary care pediatrician in Richmond and a co-founder of Climate Health Now. Thank you for joining us here in Richmond on what is traditional Ohlone land. I'd like to remind everyone to please remain masked and to socially distance. Please also kindly save any questions until the end. Today's press conference is sponsored by 3 organizations of health professionals: Climate Health Now, Bay Area Physicians for Social Responsibility, and the Alliance of Nurses for Healthy Environments. The health professionals from whom you will hear are representing themselves and are not speaking on behalf of their employers. Speaking today will be Dr. Jeff Ritterman, Dr. Teresa Munoz, Lucy Riley, RN, and Karen Dudersat, pediatric nurse practitioner. We are standing today within clear view of Chevron. The refineries that surround us in the Bay Area are the largest source of industrial air pollution, which, as you will shortly hear from my colleagues, is dangerous to health. The catalytic cracking units on these refineries, which spew particulate matter air pollution into our air, are the single largest source of air pollution that is under the jurisdiction of the Bay Area Air Quality Management District. Better technology exists in the form of wet scrubbers, which, if installed, could limit this air pollution by up to 90%. More than half of refineries in the US already use this technology. On June 2nd, next week, the 24 board members of the Bay Area Air Quality Management District will vote on Rule 6.5, which would require Chevron and PBF refineries to install wet scrubbers. Right here, where we are all standing, is a community that for decades has been an environmental sacrifice zone and therefore a health sacrifice zone. The 5 Bay Area doctors and nurses here on stage and the thousands more who support us are here to say no more. Our message to the Bay Area Air Quality Management District Board is simple. It's time to protect health over the financial interests of the fossil fuel industry and pass Rule 6.5. I want to tell you a story briefly of what it's like to be a pediatrician in Richmond. One of the first patients I ever met in my clinic was a 10-year-old boy who was born in Richmond and has lived here his whole life. He's being raised by his mom and his older sister. He's overweight. He doesn't really like school. However, he loves baseball. I met him first on a sunny afternoon when his sister brought him in straight from baseball practice in Richmond, close to my office. He was wheezing. This happens all the time, his sister told me. I prescribed him steroids, upped the dose of his inhalers. The next week, he was back, wheezing again. More steroids, allergy medication. This repeated every 2 to 3 weeks for all of baseball season. Finally, just 3 months after I first met him, after he'd been in and out of my office many times, he needed to stop playing baseball. It was hurting his lungs too much to be outside here breathing the air. It just was not safe. I trained for years to become a pediatrician, but no amount of training or medication can help this child, my patient and a member of our community. I'm here today because I am asking the 24 board members of the Bay Area Air Quality Management District to do what I cannot do when I go to work every day, to help clean up Richmond's air. BAAAQMD's mission statement reads, "A healthy breathing environment for every Bay Area resident." Members of the board, please remember your mission statement when you make this vote on June 2nd. Support Rule 6.5, require that Chevron and PBF clean up their acts and install the best available technology to decrease their pollution and to protect health. Now I'd like to introduce Dr. Jeff Ritterman.
Good morning and welcome. First of all, representing myself, this is my community. I walked here today. I'm also representing Physicians for Social Responsibility and the hundreds of doctors we represent who are all voting in favor and asking the Air District to vote in favor of Amendment 6.5. This amendment will require the refineries to put in best available technology to clean our air and make it healthier. It'll reduce particulate matter. What exactly is particulate matter? Particulate matter is just another way of saying soot and dirty air. That's really what we're asking. We're asking to get rid of the soot and the dirty air that's polluting our community. You don't have to be a doctor to know that clean air is important for our health and important for us to thrive. What I can share with you as a cardiologist is just how important clean air is to promote cardiovascular health. When the particulate matter goes up, when we have increase in soot and we have increase in dirt in our air, we also get more heart attacks, we get more strokes, we get more heart failure, arrhythmias, and even sudden cardiac death. And the remarkable thing about this is it doesn't take years for this to happen. This happens in a matter of weeks to months. And the other remarkable thing is that the converse is also true. When you clean the air, the number of heart attacks and strokes, arrhythmias, heart failure, and even sudden cardiac death improve right away. So there's probably no other vote that the Air District can do which will improve community health, which will improve the population health right here in Richmond, then voting for this. Right away, we'll see a decrease in heart attacks, we'll see a decrease in strokes, we'll see actually a decrease in sudden cardiac death. There's very few votes you can make where you can say in a very short period of time you're going to decrease the death rate. Now, this is totally in keeping with the mission statement of the Air District, and you just heard, but let me give it to you again. It's to create a healthy breathing environment for every Bay Area resident while protecting and improving public health, air quality, and the global climate. And furthermore, the Air District has gone on record as being against racism, as it being for racial equity. And these communities right here, Richmond and North Richmond, are communities that are on the front lines right next to these refineries. And for years, they have suffered disproportionately from the air quality. So not only can this vote lower the incidence of heart attacks and strokes, it can improve environmental justice for these communities that have been suffering disproportionately. Now, I know that there are others that are going to ask the Air District to vote differently on this, that they are going to ask the Air District to vote against this 6.5 amendment. But they are coming from a position of wanting to maximize oil industry profits. We, all of us here, are coming from the position of wanting to improve the health of our community. There's nothing in the Air District mission statement that says that you have to increase the profits of oil companies. Again, the mission statement: create a healthy breathing environment for every Bay Area resident while protecting and improving public health, air quality, and the global climate. So on one hand, we have the health of our community. On the other hand, we have oil company profits. We're asking the Air District to stay true to their mission, to approve Amendment 6.5, and to promote the health of our community. And we're asking community members to get in touch with the Air District directly and to tell them how important it is for our communities to promote clean air and to promote healthy environments. I'm happy to answer any questions after all of the speakers are finished, and I'm happy to share with members of the press the cardiology literature that makes it quite clear just how devastating these impacts are on cardiovascular health once we increase the particulate matter. So thank you for your attention, and thank you for taking this seriously and for urging the Air District to make the right decision to vote for Amendment 6.5 and to get us a cleaner community, cleaner air. Thank you very much.
Good morning. Thank you all for being here. I am a nurse practitioner in pediatrics. My name is Karen Duderstadt, and I have worked for many years with children in the Bay Area, San Francisco, Oakland, Richmond area, with children that have had asthma. In the past 15 years, they have been increasingly impacted by air quality in the San Francisco and Oakland area. I'm also representing the California Leadership Council of the Alliance of Healthy Nurses, Alliance of Nurses for Healthy Environments, and we join other physicians and health professionals today to call upon the Bay Area Air Quality Management District to take action and adopt the most protective standard 6.5 rule for wet gas and scrubbing technology. Nurse practitioners and nurses care for patients and families with acute and chronic pulmonary and cardiovascular diseases, as you just heard. The Advisory Council of the Bay Area Quality Management District is made up of dedicated scientists who studied the sound scientific recommendations to adopt the most protective standards based on research. We support that recommendation as providers, and we support treating particulate matter as a toxic air contaminant. The American Lung Association recently released their 2020 survey of the state of the air in the U.S. And California has 7 cities among the top 10 nationally that have the poorest air quality in the U.S. Beyond that, San Francisco, Oakland, San Jose, which they rank as the Bay Area, is number 4 out of 200 cities in the U.S. with pollution from daily particle matter. And we're also number 10 nationally for overall ozone in the atmosphere. This is unacceptable for us in the Bay Area, and it's been continuing for decades. This pollution contributes to over 150,000 children in the Bay Area with moderate to severe asthma. You just heard a very good example from Dr. Milstein about how children are suffering and having to use daily medications. Children living in communities, as you've heard, with these higher emissions from refineries, they do suffer higher rates of asthma and other illnesses. They have more school absences, and they have a higher number of hospitalizations, and this raises our public health care costs in the Bay Area and beyond, and in the state. We also know, which I wanted to make an important point on, is that children with recurrent problems with asthma have a higher level of stress and anxiety from hospitalizations, from missing school, and this impacts their long-term mental health and leads to poor health outcomes in adulthood. So it is time for Chevron and BPF to act now, as for decades they have contributed to the poor air quality in the Bay Area. Again, we are asking the Bay Area Quality Management District to honor their mission, as you just heard, by voting yes on the proposed Rule 6.5 on June 2nd and require Chevron and PBF refineries to install the technology to decrease the particle pollution in Richmond. It is extremely important that this technology it is so important for children's health that we really need to, as caring for the next generation, is it not right that we should be doing the very best we can to protect our children? And this is the first step in the Bay Area. And I would urge all of you to contact your members on the board to really urge them to vote yes in Route 65. And I also will be available for questions after if anyone has one. Thank you.
Good morning. I am Dr. Teresa Munoz. I'm an obstetrician gynecologist working in Richmond for the last 10 years. I am committed to the well-being of the community I serve. My goal is to empower women to take their health into their own hands. However, as we've just heard, there are some aspects of their determinants of their health that are out of their hands. I am here today with my colleagues to ask the Air District representatives to create a healthy breathing environment for all Bay Area residents. In the last few years, I have started to talk to my patients about the importance of the air we breathe. Sometimes it's obvious that the air is unhealthy, like when we have fires. When that happens, I ask my patients to close their windows and turn on their air purifiers if they have them. Other times, it's not so obvious. Like today, it is a clean, clear, sunny day. However, as we've just heard, the quality of the air in the Bay Area is one of the worst in the nation. The impact of air pollution on our health is an increasing concern. Mounting evidence suggests that air pollution, including particulate matter, has an impact on our reproductive health. As we have just heard, as the levels of particulate matter increase, so do cardiovascular disease. One of the most vascular organs is the placenta. This is the lifeline of the fetus. Placental dysfunction is linked to multiple obstetrical complications and poor pregnancy outcomes. In the United States, May is Pre-Eclampsia Awareness Month. So I want to mention that there are studies that show a significant association between preeclampsia and exposure to PM 2.5 or fine particulate matter. They show that there is less blood vessel formation, decreased blood flow, and increased oxidative stress in placentas of females who are exposed to PM 2.5 during pregnancy. Preeclampsia is a condition in which a pregnant woman with previously normal blood pressure develops high blood pressure. In the United States, it is one of the leading causes of maternal deaths. There is approximately one maternal death related to preeclampsia per 100,000 live births. For fetuses, preeclampsia can lead to poor growth and preterm birth. After birth, these infants are often admitted to the neonatal intensive care units and can have multiple complications from infection to intracranial hemorrhage and even death. In the healthcare system, we spend hundreds of thousands of dollars in every NICU admission, not to mention the psychological and emotional costs to mothers, fathers, and babies. In the last 10 years, I have made this diagnosis many times. I've had to tell expecting mothers they have to be admitted and monitored and even delivered, sometimes extremely early. This knowing that the risks of continuing the pregnancy outweigh the complications of prematurity. I have admitted women to the ICU and separated them from the newborns because of life-threatening complications of the disease. These women are your constituents, your neighbors, maybe even your friends and family. There is a growing body of evidence that suggests exposure to fine particulate matter is associated with poor pregnancy and reproductive outcomes. I am asking the Air District to stand with me for our mothers and our babies and to remain true to their mission. You can decrease the suffering of expecting mothers and their future babies. Please keep your word. Create a healthy breathing environment for every Bay Area resident while protecting and improving public health. Vote yes on Amendment 6.5. Every Bay Area resident, please contact your Air District representative and urge them to vote yes on Amendment 6.5. Thank you.
It is a beautiful day in Richmond, and I would like to thank all of the wonderful healthcare professionals who have joined us today as patient advocates for the most marginalized people in our community. My name is Lucy Riley, and I am a critical care nurse. I have lived in Richmond for 14 years, in the Bay Area for almost 2 decades. My work as an ICU nurse since March of 2020 has been on the front lines of the global pandemic. As nurses continue the battle against COVID, we have seen a bad situation in healthcare staffing turn for the worse. Already facing a severe nursing shortage by 2030, desperation led hospitals to call upon even retired nurses to help fight this merciless virus. We have fought the good fight, armed with little science to combat a virus which has taken millions of lives and left tens of millions more with what could well become lifelong debilitating illness. Within months of the pandemic lockdown, Black Lives Matter protests brought long acknowledged racial disparities in healthcare into sharp focus for bedside nurses. In those terrifying months, nurses watched helplessly as the worst ravages of COVID devastated our most vulnerable patients and our most marginalized communities, like here in Richmond. These at-risk patients were already suffering from chronic diseases like asthma, diabetes, and high blood pressure. We know that those underlying disease processes made many of our Richmond residents far more vulnerable to losing their lives to this deadly virus. Today, I join my fellow healthcare professionals as we acknowledge a far greater threat to human life than COVID. That is the existential threat of our mutually assured destruction, raining down on us in the form of toxic air from fossil fuel giants like Chevron. Everyone is familiar with the adage, an ounce of prevention is worth a pound of cure. We stand here today unified in our message. The fossil fuel industry needs to be held accountable to our patients who live and breathe under the ravages of their toxic plume. The benefits of cleaner air for our most vulnerable patient populations far outweigh the cost for the wealthiest oil-producing corporation on the face of the earth to integrate life-saving technology into its refinery infrastructure. For Black lives to truly matter, they must matter for the entire life cycle. We are asking healthcare professionals and the public to join us on the front lines of the fight against climate change by demanding our Air Quality Management Board vote yes on Amendment 6.5. The time is right. The demand is clear. Chevron and PBF refineries, clean up your act. Folks, if you're watching from home, I want to encourage you to go to the Bay Area Air Quality Management Department website, which is listed right here. That is BAAQMD.gov. Under your menu, you're going to go to About the Air District, and then you're going to click on the Board of Directors, where you will find 24 elected officials from 9 Bay Area counties and cities all over the Bay Area. Please reach out to your elected officials and demand that they make the air cleaner for your family, your children, your grandchildren. Folks, we can do this together. Thank you so much.
Does anyone have any questions? Take my mask off. We also, I know people may be submitting questions through Facebook, which we will address after we finish the live stream. Patty?
So, is it okay for children to be outside on days, you know, even if the air quality isn't that bad? Isn't it okay for them to be outside? and run around?
I can answer that. Patty's question was, is it on days that the air quality is okay, maybe yellow, is it okay for kids to be outside? The ultimate answer to that is no. Likely over the course of their lifetime, even more immediately, the answer to that is no. PM 2.5, which is what you've been hearing about today and what's emitted from the refineries, is invisible. We can't see it, we can't smell it, but it gets deep into our lungs. Especially for children and babies who, for a variety of reasons, are more sensitive to PM 2.5. They breathe at a faster rate, their lungs are still developing, their immune systems are still developing. The consequences to them of breathing PM 2.5 are very drastic and result in increased rates of asthma, respiratory illness, bronchitis, and other upper and lower respiratory disease, emergency department visits. The list goes on. So I would say, as much as it pains me to say this, the answer is no. For kids, when there is PM 2.5 in the air, it is unsafe to be outside.
I think just one further point is that the particulate matter impacts the lung development of infants, and even preterm, we're aware of that at birth. So a child who has more limited lung development over the first 2 or 3 years of life due to particulate matter, therefore is more at risk for other kinds of conditions which you've heard us speak of this morning, particularly asthma, and that causes more long-term chronic health issues. So it really is an urgent matter for the board to vote yes on the amendment Rule 6.5. Thank you.
Any other questions?
Could you tell us again, who do we contact? We can't see it on the screen.
Oh, absolutely. Okay, so for anyone listening who lives in the Bay Area or even beyond, what we're asking today is that you contact the board of the Bay Area Air Quality Management District. This is the website Lucy walked through. I'll let you stand in front.
Can you walk us through again where we have to go?
Sure. So folks, if you'll take out your cell phone, your smartphone, and type in BAAQMD.gov, click on your menu, click on About the Air District, and then open up the link to see your board of directors, which again are 24 elected officials from all over the Bay Area, all 9 counties. You can contact your supervisor. You will probably find someone from your municipality that's also been appointed to this board, who is an elected official from a city council. Please, folks, reach out. Help us do the work. Help us reframe the debate. Help us change the destiny of air quality in the Bay Area. Thank you.
Yeah.
Excellent. All righty. Thank you all again for being here today.